Hello everyone, it's Dr. Durst with Revitalize MD, and today I want to walk you through a neck thread lifting. So basically with a neck thread lift, we're basically tightening the jawline. So sometimes this can involve lifting threads right above the jawline or below, but it tightens that area. Those lifting threads give you the immediate lift, and then we combine it with some smooth threads in this area to tighten that area under there. We all have problems with that. So we're gonna walk through the procedure today so you can see it. But before we do, please like, subscribe, hit the button, share with friends, and comment. Let us know what you think and what you want to hear more about. All right, so here's the thread. It's a 4-inch thread, and sometimes we will put that lifting thread below the jaw, sometimes above the jaw, sometimes a couple below the jaw, just depending on what the patient needs. We mark our entry point, we numb it with lidocaine, and basically we're marking on the other side the same thing. We're going to numb that area before we ever do an entry point. The entry point is after the numbing so that we can then use a cannula, because we use a cannula to numb the track of where we're placing the thread, and so that everything is numb by the time we put the thread in. This is us just creating an entry point. We're doing 2 threads underneath the jaw, and we're gonna put the entry points on this side. Again, she's already numb. She can't feel any of this, and it just opens up that entry point. Now, this is a numbing cannula. So we're gonna go in the track and place some lidocaine so that she can't feel it. You can see that area underneath her chin, where we're going to do some smooth threads after to kind of fill that area out. You know, there's a little indentation there that we're going to try to improve. You know, it's going to tighten up underneath, and now she's going to be all numb for that. So now we move to the other side, entry point, and along that we place some lidocaine so that by the time we put the thread in there, it is all numb. And the thread's a little bit bigger than this cannula. Again, these are cannulas. The only needles we use are for numbing and for opening the skin, the entry track. This is the cannula. So we go into that same track underneath. We're going along the jawline to place it. You know, sometimes we'll reposition because we got to be perfect. You can't be too superficial, and obviously you can't be too deep. You need to be right in the right plane. That's why it's important that you go to experienced providers for these. And they're in the right plane. That thread is advanced a little bit, and then you pull out the cannula at the same time, and that thread stays in place. And then when we're cutting later, we will get some additional lifting and tightening around the jawline as we cut. So again, we're going to do one more under there. And then after that indentation, again, right underneath the chin, it's just perfect to add some smooth threads to these lifting threads underneath there. Subsize through that fat, tighten it, build collagen, elastin, and fill out that area so that that area underneath the chin that's been bothering the patient improves. So again, these are lifting threads. This is a molded thread, and so it's a very thick and robust lifting result that you get with it. And again, so now those threads are in, they're going to stay underneath the surface. Right now we're engaging the thread, you know, just making sure that everything feels good. And then we're going to end up cutting, but we get a little additional lift. Got to pull that skin tight so that the skin comes over the thread once it's cut and stays underneath the skin. And it tightens the jawline. So you will see at the very end, we'll have some before and after pictures for you to look at so that you can see what nice results. And again, not too much. You're going to see the best results, because some patients will be swollen right after, especially when we put those smooth threads in. And again, lifting, there's multiple different types of threads. There's different materials, but we use PDO threads. And this is a PDO thread. The lifting part is a molded or barbed, so it's going to get that immediate lift or tightening. And then smooth threads are just a thread, a monofilament, that is going to do no immediate results with lifting. It does not grab tissue and lift, but it does build collagen elastin. So it tightens that area up under the chin. So we're doing the same thing on this side. And then we'll move to the smooth threads. The patient is quite comfortable during this. You know, sometimes she's talking during it, which is not a big issue when we're going underneath the jaw like this. But she's comfortable. She gave us feedback, no problems at all with the procedure. She lets us know if there's any discomfort or pulling. And again, we move around, we fill in that area. We can tell that it's in the right plane as you're placing it. And then just engaging it after. And then we will tighten the skin, get a little more lift with that. And you'll see that tightened jawline right there. That's what you want. And then it gets better with time. And we're going to add the smooths right now. So right now, we're starting to put some smooth threads right through that indentation under her chin that bothers her. So we're going to place them. These are a little more superficial and build collagen and elastin. Again, you can see how comfortable the patient is during this. And we'll show you when we're done with the smooth how it starts to fill out that area and looks better immediately after. And again, smooths usually do not have an effect immediately, but when you're doing them with lifting threads and definitely underneath the jawline like this, we find that there is significant improvement and it looks amazing after, but again, looks better at 2 months. We're usually deciding if the patient wants more threads, either lifting or smooth, 1 month and 2 months, but the best results I find are right around 60 days. And you twist those. We got them in. And then we're going to pull them out. Sometimes you get a little bleeding, but you're going to see as we start to wipe down just how it already looks better. Thank you everyone for watching that video, and hopefully that helped put you at ease when it comes to thread treatments. They are very comfortable and they're amazing, and we love threads, and so do patients. It's quite addictive. That's the downside to threads. So again, like, subscribe, share, and let us know if there's anything else that you want to see more of, or if you have questions or experience with threads, let us know. And again, we're here to revitalize your look, your health, and your sex life.